You can use it to treat various things. You can use this for sinus. You can use it for menstrual pain. You can use it for problem of infertility, problem here. You can use it for knee pain. You can use it for gut problem. And generally, Moxa can be used for prevention, service, repair, and restoration of the body functionality. So, what is needed as preparation for moxibustion? Here I have various items. I want to take you through them. To do moxibustion, you need to be prepared. You just don't come in and start doing moxibustion. You need to be prepared. And one of the first things that you do is to have your incense. These are the incense. We use this incense to light up the moxa. Okay. The next thing you need to have is the moxa itself. So this is pure moxa. You can see there's a different. This is pure moxa. Yeah. This is used for what we call rice grain moxa. I'll show you what that is. And then we have the raw moxa. So you can see there's a difference. You can see there's a difference between the two types of moxas. One is very pure, one is not. So this is the pure moxa for grain rice moxa. This is the not very pure moxa that we use to make corn moxas that are used, for example, like the one we use on the belly. Okay. Then we have sea salt. We have sea salt here, and we use this sea salt, as an insulation between the skin of the patient and the moxa. And then we have, of course, the lighter. We have a bamboo. Okay, you have a bamboo, and we use this bamboo to switch to put off the rice grain moxa. So when we write the moxa, we use the bamboo to put it. This is very traditional, very old tradition. Then you have a tiger warmer. Tiger warmer is used for also different form of moxibustion. I'll show you. Like when you're working with people's sinus, if you're treating joints, painful joints, or you're working on the sinus, I'll show you how it's done. Then you have a balm, and this balm is also has herbs, that are used, and the balm mostly is used to hold and to stick the moxa, so that when you prepare the smoke corn, you stick it and it doesn't fall to burn the patient. And then finally, you have an ashtray where you're gonna put your used up burnt moxa. All right. So I'm gonna show you 3 types of moxibustion, just as an introduction. And I also want to tell you that moxa is not done everywhere. Yeah, there are specific areas the moxa is done. So if I can use the chart here, the map of the body, as per the fascia manipulation drawing, we'll do one here. I'll show you a rice grain here, and then I'll also show you another one here at the nova, and then I'll show you the last one on how something here at the sinus. Okay, so it's specific. Moxa is done specific. But for you to also do it specific, you have to also know how to do the diagnosis. And doing the diagnosis so that you can decide which form of moxa and which technique to use is why you're coming for the training. So even if I show you these 3 spots to treat, it does not mean you know how to do moxa. You need to be trained. Okay, boss, let's have you lie on your back. That's okay, you can have it. So I want to start with the moxa that we do normally down here. This spot in Chinese medicine, we call it stomach 36. So you have to come and be able to look for it. I'm not going to teach how to look for it. That is something you learn in the class. So I found my point. The next thing I do is come back here. And use small stick. I have to go back to my spot. I have to go back to my spot. I found it. Put a little bit of balm. Okay. We can use this spot to treat digestive problems. We can also use it to treat knee pain. We can also use it to treat chest conditions. So it's a very powerful point, and very powerful also point for moxibustion stimulation. After you have put our balm, there's the other tools to use, like a ring, but I don't have that. So since I don't have that, I'm just gonna show you basic how to do it. Come and get my Moxa. Get my Moxa, and then I make some Moxa corn. And then I stick my Moxa corn. There you go. And I can prepare my corns depending on my dosage. I can do a dosage of 3, or a dosage of 5, or a dosage of 7. But for him, because it's a demo, I'm gonna just do a dosage of 3. So I can put my Moxa corns on the side here. And remember, there are different types of Moxa. There's smokeless Moxa and there's smoked Moxa. So it depends on your preference, what you want to use. So I have my 2 cones. My 2 cones ready. Okay, my 2 cones, and the other cone is there. So the next thing is I come and write up my incense. I light up my incense, okay, and I use that to light the Moxa. I use that to light the Moxa. I can keep this one here to make it run, and I can use my Mox. So we don't let the corn to burn all the way. We have to put it so that we don't burn the patient. There you go. You can tell us how you feel when we do this. Move. Get the second one. Place your corn. Light it. Light it. You have your bamboo stick. Put it off. You don't wait for it to burn all the way so that you don't burn the patient. Do the last corn. Give us a feedback.
So far, so good.
What do you feel?
Not much, but some warmth in the body.
Some warmth.
Yeah.
Where do you feel the most of the warmth? On the gut.
Yeah.
So you can see the human body is an electrical gel, is an electrical, has electric fields, and it's able to conduct heat. just like a wire can conduct heat, but you have to do it in specific nerve points. So that is rice grain, moxa. You can use rice grain for very, very many different forms of care. It's a very powerful tool. Okay, the next one I'm going to show you is the, the belly button. The belly button. Remember, the belly button is the biggest acupoint in the body, or acupuncture point in the body. So when we put heat here, we are able to stimulate the entire gut area, the pelvic area, actually, and maybe, if you may, the entire body. So to do this, we use sea salt to create an insulation between the patient. To create an insulation between the patient and the moxa, and we use salt because salt will allow the heat to go in and it will not melt. You cannot do sugar, because sugar will heat and melt. So the salt does not melt. That's why we use salt. Come here, and I need to make a moxa cone. I have my moxa cone right there, and then I still light my incense. And I use my incense to light my cone. You make sure the cone is upright so that it doesn't fall and burn the patient. Again, I'll use 3 cones. It is more than, this moxa is more than 3 years, 4 years old, because moxa is prepared over time. When it's harvested, it is kept to dry, then it's kept again, and it's grinded and processed to be able to produce the fine moxa. This can be more than 3 years. This could be 1 year or 2 years. So it has to be processed to be that fine. The fine moxa is more Japanese, although even Chinese have it, but it's more Japanese. And we have various scholars, various teachers of these methods, and who have done it. As you see, I'm putting the moxa on his bell button, but he can tell you after I do my second one that he'll be feeling the heat, the warmth, not heat, but rather the warmth at the back of his back. Yes, here. So how does it go? The body radiates the heat. And when it radiates the heat that way, it also radiates the heat all the way into the body. Again, we don't burn the cone all the way to finish. So when we got the cone 3/4 done, we get it off. Then we can do a second cone. Remember, the reason why you're coming for the training is to understand the acupoints, is to understand the diagnosis, is to understand what condition to use for what kind of moxa, and what points to use for what conditions. Because there are very many places that you can do moxibustion in the body, but you need to understand where, when, how, and why to do it. So it's not just burning, it's not just about burning stuff. It's having an understanding of why you're doing it and how you do it to help the patient's problem that they have. We also have a different form of moxa, that is the stick moxa. It's the modern moxa. It's part of the smokeless moxa. And this is that kind of moxa, the smokeless moxa. In this one, it just sticks. You stick it somewhere and then you light it. We also have another stickless moxa, smokeless moxa that you use to burn to do for the year. So when you come, you're gonna have a variety of ideas, a variety of things that you're gonna learn. It puts you in a deep relaxation. It puts you in that very deep sympathetic mode that your body goes in a deep rest. Why? Because the heat spreads throughout the whole body, opening different channels, opening different blockages that are there in the body, and giving the body that tonification. Blood gets tonified, gets more energized, and that way you get to relax and you get your body to heal and function better. All right, we do the last one. Yeah, some people have been saying, "Oh, this is witchcraft. Nobody should burn heat on your belly." Well, there's nothing witchcraft here. This is all science, and it's all old school tradition. Our grandparents used it. It has been used to heal the body and restore human functionality for thousands and thousands of years. So it's just that we are starting to use it here now in Africa, and it's high time that we embrace various forms of helping the body function better, helping the body relax better, because we live in a world that is so strenuous. We are so stressed out, we are so hyped out that we never get a time to feel how our body should feel. Yeah, he just did ice bath and it's like he's gone to coma already. He's really gone to sleep. So you can imagine having her done ice bath and then we put energy in your body, it will knock you out. This can be used for many things: menstrual cramp, indigestion, infertility, constipation, weak bladder. But you must be trained to know how to use it so that you can use it with care and you can use it with least chances of causing injury or causing a side effect to the patient. Without the training to understand how to do the diagnosis, to understand how to collect their history, to understand how to place the moxa where and why, you don't want to just to do it. It's like taking painkillers or drugs without a reason. All right, we are done with this one now. So I'm gonna. What are you feeling with this one? With the second one, turn to my side. Don't kick so much that I don't kick that. Come back. So you can see it's a clean process. After you're done, it's very clean, and you remove your salt. All right. How are you feeling with the second one? Give us a feedback. You slept.
Nasikia usingizi.
So that's the second part. Now I show you. How to use the tiger warmer. This can be used with nasal congestion, headaches, joint pain, you name it. Again, you just need to be trained on how to use it. So this is called a tiger warmer. You put the incense in. So this is the incense. You put it in here. Okay. And then once it lights up, you use the cover. And the incense is ready. So you need to adjust it. Okay, my incense is ready. I wanna wait for it to warm up. Yeah, so assuming that my patient has a problem with nasal congestion, sinus, I'll ask him just to close his eyes and is it too hot?
Mm-mm.
That's how to use the tiger warmer for nasal congestion. So I've shown you just an intro of 3 different ways of using a moxa and how you can use it to treat various things. You can use this for sinus, you can use it for menstrual pain, you can use it for problem of infertility, problem here, you can use it for knee pain, you can use it for gut problem. And generally, moxa can be used for prevention, service, repair, and restoration of the body functionality. Karibu sana to the training of fascia of Moxa and Shiatsu this August, 24th to 28th. Yeah, so those are the three. Those are just few. Then I would want also maybe to demonstrate in brief Shiatsu. Maybe you can lie on your belly. We have to remove the.